Hello, everyone, and thank you for joining the seventh webinar in our Pandemics and Society series. Today's event is Climate Chaos and its Tolls on Health Systems. It will focus on the current climate crisis, the relation to infectious diseases, and how both impact our health systems. I'll now pass it to our moderator today, Jennifer Nuzzo, Professor of Epidemiology and Director of the Pandemic Center at Brown University School of Public Health, to get things started.
Hello, everyone. Thank you for being here to join today's discussion. The climate crisis has been steadily worsening in recent years. We've seen a succession of heat waves, wildfires, and extreme weather events like flooding. And each of these events can pose serious risks to human health. Health systems have to deal with the patients that are affected by these events that may result in a surge of patients. They may have to do this while contending with structural damage that these events cause, which can impact their ability to deliver care and provide services. That's just one way that climate-related effects can stress health systems. But also at the same time, we are having to contend with new patterns of disease transmission that may are likely linked to the changing climate. And so, for instance, across the globe, vector-borne diseases have been on the rise. Most concerningly, after years of decline, we're seeing global malaria deaths increasing once again, which is a very concerning development. The United States has absolutely not been spared from these trends. This summer, several states reported locally transmitted vector-borne diseases in the a number of vector-borne diseases. We've been seeing dengue for a few years now, but the U.S. recently reported locally acquired malaria cases for the first time in 20 years. And all of this amounts to a lot for health systems to contend with and prepare for. And they must do this at a time of incredible vulnerability after bearing the brunt of the effects of the worst pandemic that has occurred on the globe for the past 100 years. Preparing health systems to be ready for these sorts of effects requires having good knowledge of what's coming down the pike. We need to understand what the challenges are and where to develop measures to address them. So that's what's going to be the topic of our discussion today. And to help us unpack all of this, we are incredibly fortunate to be joined by two esteemed panelists, my colleagues here at Brown University School of Public Health, both of whom have a wealth of knowledge and experience working at the intersection of climate and human health. So we'll be joined by Dr. Rachel Baker. Dr. Baker is the John and Elizabeth Irving Family Assistant Professor of Climate and Health, and she's also an Assistant Professor of Epidemiology and Environment and Society. And her work here at Brown focuses on the impact of climate change on human health, and in particular, focusing on infectious diseases. We'll also be joined by Dr. Alan Just. Dr. Alan Just is the Associate Professor of Epidemiology and Environment and Society, and his work here at Brown focuses on the effect of air quality and heat on health and the health disparities that are caused as a result. So each of these two experts is equipped to talk about the challenges that we currently face when thinking about the climate crisis. And so I'm going to kick off the conversation with a few questions, but I invite everyone who is listening to submit questions via the Q&A box, and hopefully we can have a good discussion that can get to some of your questions. So with that, let me just open it up to you both, Rachel and Alan. Maybe we'll start with Rachel first, but just to kind of talk generally about your work on climate and health, and what are you thinking about? What are you working on right now? Just tell us what's going on.
Thanks, Jen, and thanks for the introduction. I'm delighted to be here. So my work is really trying to understand how climate change is going to impact the spread of infectious diseases. And I work across a range of different pathogens, and a lot of my work is trying to come up with models that predict the spread of infectious diseases in the present, and then use those models to then project forward into the future to understand how climate change could impact future risk. So it's a lot of computational work. It's a lot of digging into the data. We're using these large climate data sets, and we're bringing those together with infectious disease surveillance data sets, trying to get really good models to capture the spread in the present and then project those forward. A lot of my work has been specifically on the respiratory pathogens, which have been a bit less well studied. There's obviously kind of a robust understanding of the role of climate change in driving vector-borne disease transmission, as you mentioned, and a bit less work done on some of the other pathogens out there. So I'm trying to sort of pick up and look at some of those. So respiratory pathogens such as COVID-19, influenza, respiratory syncytial virus or RSV, some of the other directly transmitted diseases, waterborne diseases as well, the enteroviruses. We've done a bunch of work on those. And I guess just to address your final question of something I'm working on at the moment is we're trying to look at the enteroviruses, which is this interesting family of many different viruses in this family. And the key thing about them is they tend to peak in the summer months. And one of the kind of historic enteroviruses that we've now almost eliminated is polio, and that'd be one that most people are familiar with. But there's some other enteroviruses in the family that cause diseases such as hand, foot, and mouth disease, which tends to be a concern for young children, and acute flaccid myelitis is caused by enterovirus D68. So they still have a big burden, and they tend to see outbreaks in the summer months. And we often think of many diseases, directly transmitted diseases, being wintertime diseases, but these are summertime diseases. So we're trying to understand what drives those summertime outbreaks. Is there some possible positive correlation with temperature or other climate factors? And what could that mean for climate change if we have this positive relationship with temperature? Could that drive more intense outbreaks in the future? So we've grabbed a bunch of data on these viruses. We're trying to model them in the present and use that in understanding to synthesize and project forward under different climate change scenarios. So that's just a snapshot of something that we're looking into at the moment.
That's really fascinating. And I appreciate that you're sort of broadening the aperture in terms of thinking of infectious diseases and climate. And to your point about, that a lot of the prior work has focused on vector-borne diseases, which of course is quite important, but thinking about the impacts on other diseases really, really quite fascinating. Alan, what about you? What's on your research agenda these days? I think you're on mute, Alan.
So much. I reconstruct place-based exposures to air pollution and temperature. My work uses data from satellites, from NASA and other governmental agencies. And so I've been focusing on the health impacts and exposure disparities of air pollution and extreme temperature. Some of that is early in life. So some of my work is on spontaneous preterm birth and birth outcomes, effects on in the postpartum period as well. And some of it is in later life, thinking about how air pollution impacts life expectancy and using registries related to hospitalizations or mortality. The air pollution and the temperature literature, the work kind of goes together. We see that we've had a lot of improvements in air pollution over the last 20 years. In the United States, the Clean Air Act has been very effective, but those improvements are threatened. A lot of the emissions from wildfires are leading to big episodic exceedance events where we have very stark examples of bad air quality. And so we need to come up with adaptation strategies. We need to give people information and actionable tools. One of my interests is about new satellite instruments that make it easier for us to monitor rapidly changing conditions. And there's a new satellite instrument that was launched last April named TEMPO. That's funded by NASA. That's going to scan over North America hourly, so we can get time varying information about the conditions and hopefully start to give people information that they can act on at different levels, individuals, but then also thinking about sports groups or facilities, or more broadly thinking about our social adaptation. So those are the kinds of things I've been thinking about in both the temperature and the air pollution space.
Are you seeing any trends, just to maybe draw it out for people who aren't so familiar with that, which sounds like a pretty robust body of literature, but what are you seeing in terms of health effects of, you said a little bit about the air pollution situation is getting better, but we are, of course, now seeing new air pollution events linked to climate like wildfires. But what are you seeing in terms of trends and health effects? And what kind of health effects do you look at?
Yeah, so we know that air pollution is a big problem. And I would say another theme is that the more we study it, the more we realize that it's linked to more kinds of health outcomes than we had previously realized. And so when we're talking about air pollution, I primarily study fine particulate matter. So these are particles that are the regulatory standard is focused on particles less than 2.5 microns in diameter, so just a fraction of the width of a human hair, tiny little particles. And these can get deep into the lungs, they can cross into the bloodstream, they cause systemic inflammation, they can be translocated into the brain. So they're related to cardiovascular and respiratory health. They impact the kidneys and impact renal disease. They impact brain function, how we feel. And I mentioned already pregnancy outcomes through to the end of the lifespan and mortality. So I would say the theme is that air pollution is pretty bad for everything. And as we've studied these, and even as we've made improvements, we've recognized that to protect public health, we need to get more stringent about reducing air pollution. The other theme of my work is that as we've gotten better at studying this, we've realized that the exposures and the impacts have greater disparities than we used to assume when more of the data came from solitary sites where we were monitoring and measuring these kinds of exposures. And the same is true when we think about extreme weather. So we're not all experiencing what we're told is happening at the closest airport. There's a lot of variation. Some of that can be very fine scaled from neighborhood to neighborhood. And so the intensity of a heat wave, the severity of an extreme weather event, it can be very localized. What you experience really depends on where you are. And there's a big role there in structural racism and differences in land use that then relate with residential segregation. And so, you know, how bad a storm is depends on where you are. You know, are you in the path of the storm? Are you in a low-lying area? How bad a heat wave is, you know, it's very different if you live somewhere with tall trees and a lot of shade, or if you're, you know, right next to a lot of pavement.
I had a follow-up question
Yeah.
for you, Alan, if I can just jump in as you were talking. You sort of mentioned wildfire events, which we know are sort of increasing with climate change. I was curious if there's been any work to compare the impact of air pollution from these sort of episodic but intense events versus sort of continuous but lower level background air pollution that we might get from, I don't know, industrial utilities, for example. And are there different health impacts if you have rare but more intense events versus sort of low level but continuous background exposure? I'm curious if there's been work on that.
Yeah, so that's really relevant these days. It's a great question, and it sort of acts in several different ways. So the first is that the toxicity of particulate matter that I'm studying is dependent somewhat on its composition. And so the regulatory standard is about the mass, the concentration, mass concentration that you're exposed to, but we also know that the composition matters. And so the composition depends on, you know, where it's coming from. Is this an emission from a tailpipe, right? Or is this smoke that's coming from a wildfire? Has that smoke aged, you know, long range transport? So sometimes in the US East Coast, we're getting smoke that originated several days ago, far away. And even over that time, that changes the composition. And also what are the co-exposures? Are there other components or air pollutants that are coming with it? So I would say we think that wildfire smoke's pretty bad for you, right? It's not benign. You know, there are other sources of fine particulate matter that are you know, also being driven by accelerated by climate change. So, you know, drought leads to more dust, and you can have sort of mineral composition of fine particulate matter, often a little bit coarser, versus this kind of episodic wildfire. I would say that we really have to remember that people are getting both. So they're getting both the long-term sort of lower concentrations, if you live near a highway within a few hundred yards of a highway, you're going to get sort of this extra burden, and it's not random in our society who lives near those extra sources. And on top of that, you get these episodes, these higher exposures. So the Clean Air Act is set up with regulatory standards for both chronic and acute, like 24-hour, and we've had less ratcheting down, less tightening up of those short-term exposures, and less study of those. I'm really interested in that question that you had, Rachel. What is the impact of a peak, of an episode? I think that, having new satellites that help us measure that is going to be really helpful, right? Because no one is breathing averaged air. Maybe you're standing next to the highway for a few minutes while you're waiting for the bus, or maybe, you're outside playing, with your kids, and you notice that the sky is turning orange. And I think that those episodes also provide an opportunity for some actions. So I really like to point people to in the US, the Environmental Protection Agency has a website called airnow.gov. It has an app, you can put it on your phone, and it's going to tell you about localized air pollution, air quality with some actionable steps. But I think that the health studies need to consider both that long-term chronic exposure. When you look at the Institute of Health Metrics and Evaluation, IHME, Global Burden of Disease, they say that air pollution is the #1 environmental contributor to the global burden of disease, thinking of environmental health risks. But they only consider long-term chronic exposure in that. On top of that, we need to consider that there is this effect. So we had a new paper out this week about day-to-day variation in PM 2.5 air quality in Mexico City and its relation to mortality. And we see that when you have higher air pollution, all-cause mortality in adults goes up, and particularly in these subgroups that are related to the kinds of causes that I talked about before: cardiovascular, heart attacks, strokes, particularly in older individuals, both men and women, but there is some variation in susceptibility. And so I think, the shorter term variation, maybe you can act on that a little bit differently, Rachel, to your question. If it's really bad, maybe today's a day to move the soccer game and say, let's hold it on a different day, right? Well, let's not have the children playing outdoors today. But that chronic exposure, if you're exposed, if it's sort of consistently bad air quality, sometimes we see that in more urban settings, that's more of a challenge, because that day-to-day variation, you can't just shift things around. You can't tell people to live indoors. That's also not fair and not right. And so I think we as a society need to think about both kinds of risks, and not continue to add on, our tailpipes, our 4th of July fireworks, our coal-fired power plants. They make that burden worse. So we need to think about what can we do to reduce our contribution, the sort of human-sourced air quality risks. A lot of the cleanup in the last 20 years has been improving fuel that's being used. So I'm really excited about some of the mitigation efforts, rolling out electric vehicles. But then we have to keep an equity lens on that and say, who's affording that? Where are those improvements in air quality going to happen, so that we can, unfortunately, we've been improving air quality without reducing disparities. We need to also reduce disparities.
Ellen, I really take your points about that we don't all suffer the same effects. And certainly, thinking through the pandemic that we have been going through, that has been one of the kind of top line lessons of the pandemic, and thinking about how to protect those who are at greatest risk or most vulnerable, I think is top of our priority at the Pandemic Center. I want to get into more about the specific effects on the health systems. But first, I want to turn it over to Rachel. And just, for those people who haven't been following this literature, I think if you sort of ask most people, like, what are the climate effects on infectious diseases? I think a lot of people, are seeing right now diseases that were once, quote, tropical showing up in states that, are very much not considered tropical. from vector-borne disease, but they probably have less, insights into the impact on respiratory pathogens. So can you just like talk a little bit more about what sorts of effects you're anticipating or even seeing? You talked a little bit about enterovirus, but I'm wondering for other diseases like influenza or RSV or other things, just sort of what are the impacts that we are like to see? And then what I want to do after that is then talk to you both about like, what does it mean for health facilities and what kind of pressures will this place on them? But first, just to hear about the impacts that you expect to see.
Yeah, so you raised a few points there, Jen. So yeah, just on the infectious diseases in general, a kind of good, very simplistic way of thinking about it is if you want to know what your infectious disease risk is in the future, look south, look southward, because everything is sort of moving, expanding out of the tropics. So diseases that were tropical are kind of moving northward. Patterns of influenza outbreaks that we see further south, we'd also expect those to move northward. In our work on RSV, that's also generally sort of a coarse way what we find is we see an expansion around the tropics, so look south and that's what's heading towards you. For the respiratory pathogens, it's a very nascent area and there has not been a lot of work on these diseases, and they're sort of tricky to study. It's always tricky to study people in a laboratory setting, but we do have some clues for why climate might impact the transmission of the disease, and we can use that to inform our models. So why does climate impact transmission of diseases like flu, RSV, COVID? There's few different hypotheses, but we think it could be something to do with virus survival, and we can do experiments in laboratory settings. And I'm trying to right now establish a kind of new research direction with a collaborator of mine who does those sorts of experiments in laboratory settings to understand how viruses survive under different climate conditions. And we can use that information to put that into an infectious disease model. So we see for pathogens like flu and COVID, they seem to be less stable in warmer conditions, more stable, longer lasting in cold, dry conditions. And that sort of matches why we might see these outbreaks of flu and possibly COVID-19 more towards the winter months. In terms of climate change, then it's really sort of nascent field thinking about how those outbreaks might change going forward. But what we tend to see around the tropics is more persistent year-round outbreaks of diseases like flu. And so if you look at Hawaii or even further south in Mexico, you will see year-round cases of the disease. And sometimes you see 2 outbreaks a year, one sort of more attached to the rainy season. It's a big puzzle in the field why we might see that rainy season outbreak. And so that's broadly what we would expect with climate change. You might see less intense outbreaks of diseases like flu, RSV, but more persistent year-round cases of the disease, a sort of longer flu season. It's a little bit more complicated than that, and because this is such a nascent field, there is a lot more work to be done on this. We do tend to see more intense flu outbreaks around rainy periods, and the projections on the climate side of how rainfall is going to change in the future are more uncertain than temperature projections, which we kind of use for most of the flu modeling. So it could be that around some of these intense rainy season outbreaks, we could see more intensifying flu seasons. But that's kind of the broad picture for those pathogens.
Just a couple of follow-up questions for you, and then I'm going to go to that next integrating question, which is one thing is that I read an article that you were quoted in, Rachel, where you were talking about what a longer flu season could mean for the evolution of the virus. And I'm just curious if you want to kind of talk a little bit about what you were thinking in that, because I found it interesting and I think others would too.
Yeah, so that is again, it's preliminary work, and that was unpublished work. So you should take that with a grain of salt, and it's something we're trying to push out and make sure we get it through the peer review system. But the idea is that these broad scale dynamics of what we see for outbreaks of diseases like flu could impact the evolution of the pathogen. And so the hypothesis is in places where you have year-round transmission, you get these longer chains of transmission, essentially more opportunity for the virus to evolve over time. And what we would project in the future is that it would be a broader geographic area of places that have those kind of year-round flu circulation with climate change. So we would, as these places get these less intense outbreaks, cases are spread more throughout the year. And so more places having this chance for the pathogen to evolve over time. And this could impact the diversity of flu pathogens that are circulating And it's something we really want to take into account with our surveillance systems, and we want to take it into account when we're planning vaccine strategies as well. So again, it's early stage work, but I think it's an area that needs more work. The sort of the role of climate and geography in flu evolution, it's still an uncertain linkage there, and that's what we're trying to build out in this research, is trying to understand that a bit more, because the implications could be quite severe.
And another quick question. So the past few years, we have often seen a rise in COVID cases, sort of in the late-ish summer. It's been a little bit different in terms of when it's occurred, and then a subsequent rise, you know, in the around the kind of holiday period. And a lot of people sort of shorthand kind of explain that occurrence as, you know, people starting to return to indoor environments and spending more time indoors. I feel that those statements are sort of said without a lot of evidence to support them. So I'm just curious, from your perspective, what do you think about that hypothesis? Do we have solid evidence to say that?
If it was indoor environments that was the only thing that mattered, then we should be seeing flu, COVID, RSV all kind of like hitting exactly the same time point, and that's not what we see. We do tend to see more of a staggering. COVID, it's, you know, we're really early in the time series, to be a sort of data nerd way of thinking about it. We're still, you know, relatively early on in the pandemic, so it's hard to sort of clearly define what the pattern is at the moment. But for some of these other pathogens, we do see different timing of the disease. And we also see quite clear latitudinal gradients in that timing. And so if it's hard to explain that away with just human behavior, people moving indoors, and especially when you get closer to the tropics, it's not quite matching up with the human behavior story on its own. So that's when we start to think that there is this climate factor that's involved. Now, of course, climate can also drive people indoors, and that's one of the linkages that's just really hard to tease out in experiments. And we can, you know, we can look broadly at the climate effect, but how this role of climate on virus survival versus human behavior is a tricky thing to pass out in the data. And it could be one of the drives as well. Climate drives people indoors, and those things come together with virus survival. But it's just people moving indoors on its own. I think there's probably more to the story than that.
Okay, so we want to talk about now health systems and what health systems, and I'm, you know, in this case, largely talking about health facilities and health service delivery, but, you know, there are broader impacts. And so each of you are looking at this kind of climate health dimension from a different perspective. I'd like to hear from both of you. What do you think health systems should be anticipating in terms of plans? I mean, clearly when there are big storm events, we know that there are some people who are, you know, physically harmed by the events and therefore require care. We also know that those big storm events can imperil health facilities just because they disrupt their operations, and that is an important challenge. But in terms of the indirect effects, you know, not the direct effects of like an acute storm event or something like that, what trends may we anticipate? I realize this is, you know, maybe not fully, you know, demonstrated yet, but what effects might we health systems expect to see from what you are seeing in your data in terms of how climate is affecting human health? Maybe I'll start with Alan.
Thanks. Yeah, I think that, you know, we talked about how there's a lot of variation of what people are exposed to. And I think that what we're going to see related to climate change and its impacts on health systems is a need for sort of resilience and flexibility to address compound risks. I think that what's going to happen is increasingly what drives the worst health outcomes are this layering of different kinds of climate and non-climate disasters. And we've seen that particularly in the last few years, you know, large tropical weather systems hitting during a pandemic, and you know, are asking people to evacuate, but not go into congregate settings. We see that when, you know, the power grid in Texas had a major catastrophic failure during a time that it was so cold that it impacted people's health. And so it's really these intersecting, compounding risks that are then going to drive more demand on the health systems, and they're also harder to predict because they rely, they're related to multiple bad things happening at the same time, right? In space and time, wildfires during infectious disease outbreaks. These are just things we haven't planned for, and they're different communities that haven't been talking. There are times when there's a risk and we say you need to stay indoors, and there are times when there's a risk and we say don't be indoors. And this sort of intermixing of different kinds of risks, I think is harder for health facilities to plan for, and to think about the scalability of their response, when it could be that a well-predicted extreme event, if we're able to get the word out, might not drive an enormous surge in the same way in which the same event, if there's an infrastructure failure, could lead to real catastrophe. And you think about the dependence on air conditioning. If the grid goes down during a heat wave, it's a very different thing. And so I would say health systems need to think about compound risks, and the complexity there is forecasting and overlaying different kinds of challenges that can arise and be intermingled.
Rachel, what do you think?
So I think from an infectious disease perspective, health systems need to be prepared for weirdness, things popping up that doctors in that particular hospital have not used to treating, and not used to seeing, and not used to testing for. And so that's, as you talked about, so the re-emergence of some of the mosquito vector-borne diseases in southern parts of the US, things that we expect the unexpected. And now that's a really hard thing to do. And I think this is where it comes to the role of scientists in this. And what I see my role is to try and provide the best information and try and provide good projections, so we can start to prepare better our healthcare systems for what's coming. And we need to give people working in health systems information for what's coming. And this is where it's really important, I think, for people who are working in public health, who are working on infectious disease outcomes or other health outcomes from climate, to also partner with people in the atmospheric sciences, geosciences, to develop projections looking forward as well. So we're not just working in the present, we're also looking further down the line. When can you expect dengue to emerge in Texas or further north? So what sort of timeline do we expect those outcomes to happen? When can we expect the flu season to start shifting in terms of the timing of the outbreaks? Or when could we expect 2 peaks in the year? What's happening with the enteroviruses? Are we going to start to see more intense outbreaks in the summer? We just need to give everyone a heads up. And I see my role as scientist is I'm generating that information, I'm generating that knowledge, and I want to work to try and provide that to health systems so that we are better able to adapt looking forward. And we're not in this situation where we're dealing with the unexpected. We're seeing symptoms and we're like, what could this possibly be? This is not something that we would expect for a patient in this particular location. So what we want to give everyone a heads up in terms of these climate change impacts on human health.
And for both of you, I mean, we're coming 3 years of the pandemic. In many places, the health system is not as strong as it was when it went in at the start of the pandemic, in part because of, just the incredible, unrelenting stress, but also a lot of staff attrition and other things. And so, adding additional demands on health systems can, be quite harmful. And so do you, from both of your work, sort of anticipate that there'll be more people in need of care? And will that be at the same time? Because that also matters. If it's spread out over time, that's a different kind of stress. It's still stressful. But is it possible, the surge overlapping with, a system that's already kind of, on a good day, sort of strained to its max? Alan, what do you think?
Yeah, I think that the increasing frequency of, what I was referring to as episodic events, right? So heat waves, wildfires, extreme storms, I think that they do tend to drive surges in need, in demand, and can pose structural challenges to the health system. You know, if a pharmaceutical plant goes underwater, literally, that can impact the supply of drugs that we rely on, right? If the staff at a healthcare facility aren't able to get to work safely, that can impact the delivery of health care and the response to the healthcare demand. I think the ability to respond adaptively, scalably to the unexpected is a lot to ask of a healthcare system that's sort of just in time delivering what it can, and doesn't always have that capacity to surge in response when more need arises. So I foresee these kinds of extreme events, the heat wave in the Pacific Northwest not so long ago, the power outage in Texas, the wildfire smoke down mixing in the Northeast that we had this summer, they were off the charts. They were events that hadn't been seen before. And then they do drive, respiratory admissions in emergency departments. You do have these situations where you're trying to help large numbers of people. You have people that come in. We already have a population that is managing many kinds of chronic diseases and health conditions. Air pollution is much more severe, for example, for people who already have a cardiovascular or pulmonary disease. And, these kinds of episodes are going to require that we're able to surge in our response to them.
Rachel?
I completely agree with everything that Alan just said, and I'm just going to put in a little counterpoint that I think, as you mentioned, we are coming off the back of the pandemic, and yes, health systems have been overburdened because of the pandemic. We've also had some wins, though. We've got great at making vaccines. So from an infectious disease perspective, that's something else in our toolkit. We have a bunch of other interventions in our toolkit for infectious disease outbreaks that we didn't have before. And so there's been increasing attention on health systems and what can happen when a health system is suddenly overburdened. And so some of that, I think, will be useful. If I'm just going to put one positive note in a conversation about climate change, some of that will be useful looking forward for climate change as well, because we've had a practice run now, and yes, things are going to be more difficult in the future, but there are some tools in the toolkit that we can also use.
Thank you for that. And I think the overarching theme of hosting this is to talk about what can we do now to enhance our tools, enhance our readiness, such that we don't just sort of succumb to these events every time they happen. We don't want them to just wash over us. We want us to be resilient. I think, Alan, you talked about the importance of resilience, so really important. I see a question in the chat, which I'm going to turn to and encourage others to put questions in there. But someone asked, while we try to improve air quality, where do you see the potential of masking? High level, though, is an equality of access issue. I think this is a general question about the role of masking in dealing with some of these air quality issues, as well as just then, of course, the idea of being able to access them. Maybe Alan.
It's a great question. High quality masks, such as N95 masks, when worn appropriately, and that's a challenge because we need to help people fit them, are very helpful in reducing. They filter out the fine particulate matter that impacts our health. And it was really interesting that when there was this extreme air quality event in the Northeast this past summer, you did see lots of people pulling out masks. And that's this transference of the lessons learned that Rachel talked about. It's kind of, it's incredible. Now, that's not a solution for everyone. And some people are able to stay indoors and they have filters, or they can run their air conditioning, which may have some filtration. The childcare setting that my kid was in, they sent out a list where they said, when the air quality index is this, we're going to take that action, and sort of taking the tools that we have. So masking is one of them. Filtration helps, right? But you need to know to use that mask. Air quality can get bad before it's perceptible. When the sky turns orange, that's quite an extreme example, but in fact, there's health impacts of much lower levels. So I think that masking, is both effective for respiratory diseases and reducing some of these environmental health risks. So it is a great example of a tool that we didn't really have widely deployed. But in particular, you need the high quality masks to get those very small particles that drive the majority of the health impacts.
I mean, this summer I remember, pulling out the not one but two and KN95 masks because I was in New York City when the sky was orange. And let me tell you, it was helped, but we still felt it. But it does, I think this is an interesting question because it does sort of raise, what the legacy or the kind of infrastructure hopefully left behind from this pandemic. And it also speaks to the importance of indoor air quality and trying to make sure that people have, not exposures within those indoors that, make them at greater risk, but also potentially protect them in events like that. I got to attend a meeting in a facility that was actually an archival facility, so very highly filtrated air. And let me tell you, that was just a wonderful space to be in. But it does make me think about, this push to improve indoor air quality and the multiple potential benefits of it, given the anticipated threats of the future. We got another question here. And it was about anything being done specifically for vulnerable ag workers who don't have resources or options to protect themselves. I don't know if anybody has any thoughts about that. If you've heard of any interesting examples, anybody want to chime in on that question?
Yeah, so the occupational setting is also very important. There are large groups of people who are outdoors, and thus their exposure is different than if they were able to stay indoors. And I think one of the advancements is to start thinking about more than one component of exposure. So heat has multiple elements. There's both the air temperature, the humidity, which is related to then our capacity to cool ourselves through sweat. There's the amount of direct sunlight and radiation and wind, which can sometimes cool us. So this sort of broader conception of how heat is related to health for individuals that are moving around in the outdoors, such as in an agricultural health setting. And they're also breathing whatever is around. And so you have some agricultural health settings that or outdoor occupational settings where we have controlled burns, maybe of agricultural residuals, or trying to do some sort of thinning, or there's poor air quality for other reasons. Being outside, there's a lot of warmer temperatures leads to more air pollution because of it increases the chemistry that forms secondary organic aerosols, and the climate change is driving more air pollution as well, speeding up those chemical reactions that form pollutants that are bad for our health. So on the heat side, agencies, states, and other groups are continuing to evolve our understanding of how to keep people cool, what sort of breaks are needed, what sort of interventions, right? How do we manage these risks so that people can be safe, healthy, productive? And I think that the push that I'm interested in this space in particular is that we need to be considering air pollution and heat not as separate things. You get an alert that there's going to be a heat event today, or you get an alert that there's bad air quality, but they're both relevant and they can co-occur. And so the threats from extreme heat, to cool your body, it's that revs up your cardiovascular system, because your heart tries to pump more blood to bring down the temperature. And so it's a cardiovascular stressor. And air pollution is also driving this inflammatory cardiovascular stress. So they're both, adding to that kind of physiologic stress. And so I think an advancement would be for our society, our public health agencies, to be considering air quality and heat sort of in more frequently in their combination. But the occupational settings are a really important one. Same with sports for children, or whoever's engaging in outdoor, vigorous outdoor activities, right? We need to be adaptive, and we need to think about what's safe. And, it is useful to call up the air quality or to look at the local weather.
I would just love to hear a bit more about the science side of that. So what's the work been done on trying to disentangle those effects of heat, air pollution, and then how they combine together? And do you see that kind of, it's not just the sum of the parts, there's the additional effect of when you combine at the same time as well?
Well, yeah, so a large consortium analysis was published this week. I just saw it come out that looked at that sort of question of synergy, right? Are there effects of having both heat and air pollution that exceed the sort of, just if you were to add them up separately and independently? And that did bear out in a large multi-country analysis of mortality that was published this past week. And so the risks are both compounded by co-occurring events, and this is kind of part of that lens of compound risks, that we, instead of sort of creating maps that you turn them on and off like separate layers, as though we only have to think of one thing at a time, we're going to have to think of many things at a time. And they're going to impact, depending on the disease or organ system that you're thinking about, they could also sort of be, super additively impacting those organ systems, right? So super additives, a fancy word for saying it's worse than if you just had one at a time. And, an example, I mentioned the cardiovascular system. Another example is the kidneys, the renal system. So, heat drives dehydration, and sort of management of body fluids, right, is made more challenging, adds stress to the kidneys, right? And air pollution also stresses the kidneys and increases the risk of kidney disease, because they play this role in filtration of these particles that get into your body systems. And so those haven't been studied together, and that's something that we're pushing to do, is to think about those. So I talked about how they co-occur. They co-occur because of the chemistry. As we have warmer systems, we're making more air pollution. And they also co-occur because when it's hottest out, that's when, everyone's cranking their air conditioning. We increase the load on our grid, and we have to turn on our peaker plants, the dirtiest sources of energy in our energy systems. And so we're also putting out the most emissions. So we are driving, and I hope we can mitigate some of that, we are driving more air pollution on the hottest days. So we're kind of inducing that correlation. We see that the worst air pollution is in the winter and in the summer, and it's a little bit better in the spring and in the fall.
That's not great from a health system perspective, I have to say, that timing. I would say we only have a few minutes left, and I want to sort of end on a hopeful note. There's a few more questions there, and some of them are like about on the topic of sort of calls to action. And I'm just going to broaden that to be like, what can we do? And you are both researchers and really excellent researchers. And what I'm struck by in both of your work is that it is providing really important information that we can use to plan better. Because like the range of things that we have to plan for is vast, and resources are few, but kind of being able to tailor, like, here is where the biggest impact is important. So bringing it back to pandemics, because the Pandemic Center hosting this, I'm struck by the fact that when we were very, very worried in the kind of early aughts about another flu pandemic happening, there was a lot of effort to improve kind of surveillance and of influenza. And as a result, we've learned a lot about the timing and impact of influenza in the past. I guess that's now 20 years. It feels like just yesterday. But we've learned a lot about it. And so, Rachel, maybe to turn to you, you talked a little bit about I can help you sort of better anticipate these things. I just want to kind of draw you out a little bit on that to think like, if you're successful, like how can this research that you're doing the kind of information that can provide to help us prepare better?
We want every city public health professional in the world to have access to projections for climate change and infectious disease outbreaks, and also health outbreaks as well at different time points. So you can plan and you can look out 10 years, you can look out 20 years, you can look out 30 years. I mean, we tend to use the climate change projections on the climate side that are available, so they go out to 100 years sometimes. Now, obviously, the world's going to look very different in 100 years, but having that kind of scale to look through into the future, I think could be really valuable, and it's feasible. It just needs to be done. When we make these sorts of projections, we're often talking, it's different from a weather forecast. We're talking about climate change, we're not talking about weather. And the analogy kind of holds on the impact side as well. So we can make short-run forecasts of what is this flu season going to look like this year. In the same way, we can make short-run forecasts for the weather, but we can also look out further ahead. And that's when we start to think about projections. So what is the broad pattern in terms of temperature changes out in the future, and how can that broadly impact vector-borne diseases, the flu season, all those different possible impacts that are out there. So developing those projections is very much what I'm trying to do in my work, and make sure that those are robust and account for uncertainty. But that's the aim, is that we give the information to people working in public health, who are working in public health systems, to give them this roadmap looking forward for what they can expect from climate change.
I asked you that question about COVID and the timing of the late summer peak, in part because, it seems to me from a public health perspective that if we knew better when these increases were going to occur, we could get ready for them. And part of, I think, knowing better when they're going to occur is understanding why they occur. And your answer to that question was incredibly useful, because I think it kind of maybe points us away from some commonly held beliefs and points us in other directions. So I'm just really grateful to you for your work, because it helps us kind of better have an understanding of what's coming down the road. I'm impressed with your vision of 100 years, but I'll even take like what's happening like this month, and something that we don't do well. Alan, I'm going to pose the same question to you in terms of like, what's the most, I know you're working, with some hospital data in the US, in Mexico, like, are people able to kind of like act upon the information that you generate? Like, what's your like kind of ultimate hope?
Yeah, well, I think that our discussion earlier about masking, teaches us that society can change rather quickly and learn adaptive strategies. And so I think we really just have to keep in mind this idea of an equitable adaptation strategies, where we're thinking about how do we help people deal with these climate-related risks. And whether that's energy assistance programs where we're helping people pay for air conditioning, it can be strikingly warmer in certain parts of the country, even within cities. There's a lot of variation. So we need this longer term solutions. We need to cut our emissions of greenhouse gases, and we need to, redesign so that our built environment is supportive. So the default is that where we live and how we live is healthy. Because if we get into a situation where the environment is unhealthy, then you're reliant on technical or social systems to keep you healthy. Then that creates, that's a challenge to resilience, right? If you're in a space where you can't thrive given the temperature, then you rely on cooling strategies. So we need passive cooling strategies. We need to be planting trees with this longer term outlook while we help people pay for the air conditioning that they need, thinking about who is most impacted with consideration of the distribution of these kinds of climate related exposures in space and time.
And, I think that, again, to bring it back to the pandemic, it's something that we very much learned about, that the environment in which we live, work, and play can very much influence our risk, and that there are, structural investments we can make to reduce our vulnerabilities and kind of buy down that risk, and, to reduce the fact that we don't all have the same risk, and some of us have a lot more. And, I think the pandemic kind of opened that question up more broadly than it had been, just sort of in the kind of environmental health field. And so hopefully if we can sustain some momentum and interest going forward from that, we'll be able to. My last question to you both before we end, and will end us promptly on time, is just sort of like wand in hand. If you could do anything, like research, anything that you could look into, if you didn't have to worry about submitting a grant for it, or et cetera, and just maybe a little short, what would you want to explore and dig into if you didn't worry about, success? Like, what's your kind of pie in the sky thing that you would really love to start digging into? And whoever wants to go first can. I have things I want you to dig into. So if you don't have an answer, I will tell you, but just let me know.
Well, so I love working with data from satellites. It's very cool, but very interesting. But I'm also, hundreds to thousands of kilometers up. It's very far away, and I'm often asked about what's happening inside people's homes. So I would love to have more data about what's happening indoors. Increasingly, people have smart thermostats, smart electricity meters. So I think partnering with organizations that have that kind of information so that we can think about how we're living and the lived experience. What happens outdoors is relevant because what's outdoors comes indoors, and we regulate the outdoor air pollution. But I would love to leverage more data to get inside.
Sounds doable to me, but okay, Rachel, you.
I would love to have more access to data from places that are less well studied, where we don't have good disease surveillance. And so we know a lot about the flu season in the temperate climates, and we know a bit less about flu season as we get closer to the tropics. Now, we know the tropics, as I mentioned at the start, is a good indicator of what's coming for those of us who live further north. So if we could get better data streams from tropical regions, and there's some countries that are doing this really well and some places that aren't, but really good surveillance data, serological data that tracks what people are exposed to over time, what sort of pathogens are circulating, what the dynamics of those pathogens are, so that we can build better models looking forward. That would be great. It costs a lot of money to collect that data myself, so that's the limiter. But if I had a wand, I would go out and sample.
Great. Well, excellent. Thank you both. This has been really fascinating. I learned a lot in this conversation, and I trust the attendees did as well. I really appreciate your willingness to step out of your busy research careers and grant submissions to share with us your knowledge and insight. So really kudos to you. I'm a big supporter of both of your work, and I'm very grateful for it. So thank you so much. In addition to thanking you, I also want to thank our everyone who attended today. Really appreciate the participation in the comments and just your tuning into this session. And I'd also like to thank my Pandemic Center colleagues, Bentley Holt, Akwiel Person, Carly Gasca, and Andrea Ulig for making this webinar possible. If you would like to share this event with anyone who is unable to attend, the recording will be posted on the events page of our website next week. And you can also find recordings of all previous webinars on our website as well. Please follow us on our social media accounts to learn about all of our events and future webinars. We try to do them monthly. And please reach out to the email address, which is on the screen, with any questions or suggestions for future webinars in our Pandemics and Society series. Thanks so much, everyone. Till next time.